Good afternoon, year 10 / good morning, depending on when you are doing this video. Today we will be looking at the classification of joints and connective tissues within our body. By the end of this session, I want all of us to know the types of joints that we have in our bodies, and then I want us to understand the role that joints play within our bodies. Before we get started, we're going to do a memory platform that is heavily based around last week's lesson. So you need to label this diagram correctly. Start with number 1, work your way round until you get to number 20. Please pause this video. I would give yourself about 8 minutes to complete this. Once you are done, then move on to the answers, but don't cheat. I'm watching you even if I'm not physically there. Don't cheat. Before we begin, I just want all of us to really know what this lesson is all about. So by the end of this lesson, we are going to know what the different types of joints are within our body. We will also understand how each type of joint aids a sporting performer, and we will be able to describe how the structure of a different joint enables movement and apply this to a sporting example. So the first thing that we need to know is what a joint is. Miss Anderson is here talking loads about joints, but what is a joint? So a joint is a place where 2 or more bones meet. What I would like you to do is copy down that definition. A joint is a place where 2 or more bones meet. Pause this video. I would like you to give yourself 2 minutes to cover that phrase, copy it and learn it. 2 minutes, go. Hopefully you guys have copied that phrase down, that key term down, you've practiced it and you've learned it. So moving on, there are 4 different types of joints. Now, these joints are responsible for every type of movement that happens within our body. The 4 different types of joints are a pivot joint, a hinge joint, a ball and socket joint, and a condyloid joint. Please write those 4 different types of joints down now. So we're going to be looking at a ball and socket joint. Please get that down as a subheading if you have not done so already. So our ball and socket joint is made up of 2 different bones. As we know already, a joint is a place where 2 bones meet. So for our ball and socket joint, you will have a rounded end of a bone, as you can see here on this diagram. And that rounded end will fit inside a cup-shaped end, which is here. You can just see that there as I've marked it off on the diagram. Please get that short description of a ball and socket joint down now. If you need to, pause the video before you continue. As this diagram shows, this is an example of the hip. Now we have a ball and socket joint in our hip, and we also have a ball and socket joint in our shoulder. Because of the shape of the joint, where we've got that rounded end fitting into that cup shape, it allows for movement to take place in all directions. So if I was a sports performer and I needed to swing a tennis racket, my ball and socket joint would be allowing that motion to take place. Please get down your sporting example of when a ball and socket joint would be used in a sport. The second type of joint we'll be looking at is a hinge joint. Now a hinge joint is very, very easy and very simple. It only allows forwards and backwards movement, very much like a hinge on a door. So in the same way a door will only allow it a door can only open and close, that's exactly the same as what our hinge joints can do. So please get that example written down now. Then we will move on to looking at where we can find hinge joints in the body. Now you have got down your definition of what a hinge joint is, we will start to look at where we can find those on the body. So we've got 3 different places where you can find a hinge joint. So the first one is a knee, the second one is an elbow, and the third and final one is an ankle. Now our hinge joints are really, really powerful because they are surrounded by lots of very, very strong muscles. Your example of this could be somebody that's sprinting. Their knees create lots and lots of power as they're driving their knees up during a 100-meter sprint. Another example of a hinge joint being used in the body is somebody that's throwing a dart, as you can see on this picture. It's just that straightforward action of the elbow that's just opening and closing. It's just opening and closing as that dart is released. So please get down your sporting example. You can either use a sprinter driving their knee upwards or somebody throwing a dart, and that would be at the elbow. The next type of joint we're going to be looking at is a pivot joint. Now a pivot joint only allows for rotation to take place, and that's because there's a ring of bone that fits over a pivoting bone. And we can see that if we just take a look at this diagram. You've got your ring-shaped bone there, and that fits inside or outside this bone, and it pivots around, creating like a rotational or creating rotation. Again, please jot that down now. If you need to pause my video, please do. There's 3 places where you can find a pivot joint is at the neck, the wrist, and the elbow. Now, an example of when somebody would need to use a pivot joint in sport would be somebody who's swimming. As they are swimming, cutting through the water, they would need to rotate their head left or to the right in order to take a breath out of the water. I've given you that example, but I would now like you to create your own example of when somebody would use a pivot joint in a sport. The final type of joint we'll be looking at is a condyloid joint. Now, our condyloid joints are oval-shaped bones which fit into other similar bones. They allow for small movements in all directions to take place. You will be able to see I've got a photo here of somebody holding a ball. The reason why I've got that is because it's movement of the fingers. It's movement of the fingers where our condyloid joints are working. So the places where we can find our condyloid joints in our body are in our carpals and in our metacarpals. These joints are really, really useful for small movements that take place around the wrists and the hands. So an example of this could be somebody in handball throwing a ball. I have got 3 different pictures here. Each of them has a green circle around them. The first one that I would like you to look at is the hockey player. What joint is being used in the circle that I have shown? If you said a ball and socket joint, you are correct. We can see that her ball and socket joint at her shoulder would be being used. If we take a look at the photo on the right hand side, Dina Asher-Smith, and we look at her leg, which joint would be being used there? Hopefully we got that correct and we have been able to identify that that would be her knee joint. And then our final photo down at the bottom right hand side, what joint is being used in order for him to release the ball? Hopefully we were able to correctly identify that would be the condyloid joints in the hands that are allowing that ball to be released. Now I want you guys to have a go at this on your own. Please click on this link and it will take you to a form. When you get to that form, it will ask you to give an example of each joint in relation to a sporting action. Once you've completed that, just close the window, you don't need to do anything else, and then join me back on this PowerPoint. The final part of the lesson is very short and it's looking at connective tissues within our body. We have 3 different types of connective tissues. The first one we're going to be looking at is cartilage. Now, cartilage is a really spongy material that works as a shock absorber in between 2 bones. If we take a look at this diagram, you can see you've got that purple padding in between the 2 bones. Now, that padding absorbs any impact that we may feel from things like jumping, running, anything that's going to be adding pressure on our joints. Now, I've put this question here: what would happen if somebody's been playing a high impact sport for a long period of time? What would happen to their cartilage? I'm going to give you a minute just to think about that question. What would happen to the cartilage in someone's knees if they've been playing high impact sport for a long period of time? So hopefully some of us were able to identify that that cartilage would probably wear away. If I take myself, obviously somebody who plays netball and used to do athletics prior to playing netball, over the years I'm sure that my cartilage within my knees will become damaged. Where I'm constantly jumping, that will wear away the cartilage. Once that cartilage is worn away, you may experience some sort of inflammation around the bones, lots of swelling, and it can be quite uncomfortable. The other type of connective tissues that we have in our body are ligaments. Now, ligaments join bone to bone. Please get that down and scrub a highlighter through it so you know that ligaments join bone to bone. The third and final type of connective tissue within our bodies is a tendon. Now, tendons join muscle to bone. Again, get a different coloured highlighter, scribble that through tendons, and just highlight and emphasise that tendons join muscle to bone. And answer the exam questions on the following 2 slides. And answer the exam questions on the following 2 slides. Thank you very much for engaging in this lesson today. Well done for those of you that have been working consistently and pushing yourselves. I completely understand it is quite challenging working from home and it is quite challenging to stay motivated, but if you're listening to this, well done for logging on. That's the first hurdle. The second hurdle is making sure that you get onto Everlearner. For my class, that will be on Friday. For Mr. Tui's class, that will be tomorrow, and making sure that you can get your tasks completed. Fantastic work, guys, and keep it up. Well done. Thank you very much for engaging in this lesson today. Well done for those of you that have been working consistently and pushing yourselves. I completely understand it is quite challenging working from home and it is quite challenging to stay motivated, but if you're listening to this, well done for logging on. That's the first hurdle. The second hurdle is making sure that you get onto Everlearner. For my class, that will be on Friday. For Mr. Tui's class, that will be tomorrow, and making sure that you can get your tasks completed. Fantastic work, guys, and keep it up. Well done.
And lastly, from me, now is the time. Once you're really confident with the knowledge that you've done today, I don't care whether you have to go back over and look at this PowerPoint a few times. If you're sick of listening to me, just turn the volume off, go back through it again, write out your notes, do what you can, but definitely go back into Show My Homework before 4 o'clock and get in there. Remember, with these quizzes, you got 3 chances to get 100%. So let's see what you can do. If you get 50% the first time round, just go back in again and see if you can learn from those mistakes. Go back in and hopefully get as close to 100% as you can. Miss Anderson's class, same thing. Get in there and let's see who can get the highest out of those 2 classes. Now remember, you've also got On Wednesday for my class, you got to go in and look at the Everlearner video to do with this topic, but just follow Show My Homework. That's the central point, to go in and find out what you need to do each day. I know all your teachers are doing it, all your teachers are going in and tracking, and all your teachers, including me, Miss Anderson, will be on Teams on the days that we normally teach it, so you can ask any questions and we can clarify any points to do. Okay, but that's it for me. Thanks very much for listening. I hope this is recorded now, otherwise it's a waste of an hour of my time. So good learning today, guys and girls, and stay safe, keep active, keep learning, don't fall behind, stick with the pace. All right, over and out.